Human metapneumovirus, as you all know, that it is a respiratory virus and it is causing infections which is similar to the common cold. It is affecting infants which are less than 1 year of age. Um, there's no need to panic at the moment because this virus is not a new one. It was discovered in 2001 in the Netherlands and it has been rotating since then. As you can very well appreciate that we've had two infants who've actually had this virus. So there's no history of foreign travel in these infants. So definitely that suggests that the virus has been there for quite some time. It is a part of the pneumoviridae family and it is a single-stranded RNA virus. As I said before, it spreads through the respiratory droplets. So anybody who's actually coughing or sneezing in front of you who has the virus, then you uh, can get the virus. And most people who are contracted is before the age of 5 years. In our case, we're talking about infants more who actually have this viral infection. Now, the symptoms, as I said before, it mainly gives rise to cough, sometimes fever, sometimes a lot of nasal congestion, and shortness of breath in really bad cases. And in more severe cases, it can also cause chest infection, which we say pneumonia, or even bronchitis, meaning they are having very short of breath on walking slight distances, especially in young children and in the elderly who are more than 65 years of age and in immunocompromised patients. In immunocompromised, I'm talking about patients who've actually had human immunodeficiency virus or patients who've actually had cancer and they are on certain medications which are which are required for the treatment of cancer, but these cancer treating drugs can also reduce your immunity. So these sort of cases, they are more prone. Uh, yes, we actually have, especially us who are slightly older, we actually have a lot of immunity against this virus because we've had a lot of viral infections in the past. We've actually had a lot of bacterial infections in the past as well as people who are traveling in buses, railways or aeroplanes. There are lots of people whom you can appreciate they're actually coughing and sneezing. So you as a whole have developed immunity against the virus. I mean, I'm talking about the younger people, especially the infants less than 1 year of age. They have less immunity because they've just come into the world. So they definitely are more prone to catch the viral disease. See, it is very important that the parents should be aware of what this disease is. There's no need to panic. Only thing is you have to be aware, and especially the parents who have infection, say they have some sort of viral illness, they have to cover their mouth and nose while coughing or sneezing. They have to wash their hands frequently before they are touching their newborn or babies. And they should avoid public places if they are symptomatic. And they do not reuse the tissue or reuse the handkerchiefs. And they should actually monitor their babies on a regular basis. Say, for example, if the baby is feeding well, for example, the baby is passing urine adequately, or if the baby is pooing, the baby's eating properly, these sort of the cases. And then you if they are not doing the same, then you have to contact your doctor immediately. So that is a sign of concern, that if your baby is not pooing properly, if your baby is not eating properly, then that is a cause of concern. As I said to you earlier, it this virus is has been there with us for quite some time. We probably did not know that the virus existed before this time, and it actually can spread with respiratory droplets. People who are actually using not washing their hands properly after coming from outside or meeting with other people, or they are touching their noses, touching their eyes and mouth without washing their hands. They are probably using shared towels, or even in public places, they are not using the proper security and safety measures. And it's again, the same thing applies here also, like we did in Corona, that you have to wash your hands frequently. You have to eat properly. Means cooked food. You should avoid eating anything which is non-cooked, and you should wash your vegetables properly, wash your fruits properly, and you should actually cover your mouth if you're going outside, and you should wash your hands frequently with soap and water. So this is actually the measures as well as the reason for the spread of the virus. See, again, it's a viral infection, so it'll present with the same way as COVID presented. COVID 19 obviously uh, uh, had lots of problems with, as you know, that there was a lot of shortness of breath and it extended to having pneumonia. Lots of patients had to undergo oxygen treatments, and we had to treat certain other conditions associated with the viral. Certain superadded bacterial infections were there. Now, these sort of things are probably not going to be there in this case because, again, as I say, do not panic, just be aware. If your child or infant becomes poorly, then you have to report to the doctor immediately so that the doctors can actually work on the child and prevent problems happening. So it's the awareness is very important in this case. As we've all gone through the corona, I am saying that this virus has been there for quite some time. And it is just like any other viral illness that we have to stay cautious and we have to observe a lot of precautions and we have to take treatment symptomatically. And if it gets any worse, then we have to report to the doctor and get admissions on time. See, the home test, there's no certain tests as we did in COVID-19. There were a lot of kits available in the chemist shops. But in this sort of cases, you have a nasal swab which can detect the virus, but it is only done in certain laboratories. It's not come out as yet, but definitely you can keep a check on your temperature. You can keep a check on the amount of water you're drinking, keep a check on whether you are getting dehydrated or not. The way to do that is measure you can look at your skin if it is not dry, or you can have a look at your urine. I mean, how much urine you are passing um, uh, per day basis. And as I said to you before, it is very, very important to look at these things, especially if you're less than 1 year of age. As far as we are concerned, we should just be able to maintain a good body temperature and stay, take a lot of rest, stay well hydrated. And basically, as I said to you before, it's just supportive care which is required in the viral illness because management focuses on mainly alleviating symptoms. So, if you have fever, you have to take over the counter medications for the fever. For congestion, you can take certain decongestants which are available. And severe cases, as I said to you before, I'm emphasizing that you should be aware of the severe cases. These cases will require hospitalization for mainly intravenous fluids. If you're not drinking enough, then you'll have to be given intravenous fluids or maybe oxygen therapy also if your oxygen saturations is low. So at home, you can measure your temperature, you can measure your oxygen saturation. Oxygen saturation kits are available in all the chemists. You can get them. And you can actually measure, say, if you are not short of breath, you can count your respiratory rate per minute. And you can be at home, you can actually take all these precautions, drink a lot of fluids, take a lot of rest, and you can actually be your own doctor at home. And if anything which is not right you feel, then you have to speak to your doctor immediately and take their help. See, it's very important. We are talking about comorbidities here. So, patients with comorbidities like diabetes or high blood pressure, they have to be very careful because they can not only catch this virus, but they can catch other infections as well. So, you have to keep your diabetes and blood pressure under control. Again, you have to avoid touching surfaces which are contaminated with the virus. Again, we don't know what surfaces are contaminated. It's again taking a lot of preventive measures like washing your hands frequently, avoid personal contact with anybody who's actually coughing or sneezing. And as I said, this mainly spreads through respiratory droplets. So, people who have low immunity, as you asked, they should always wear a mask when they are going outside. Uh, um, we have to wait for the WHO's report about that, whether the China is underplaying it or not, because obviously the WHO itself is very careful now, especially after the COVID-19. Uh, we should wait for the reports and we should wait for other international surveys, etc. Very well coerced with the preventative measures. As I said to you before, prevention is better than cure. So again, a lot of preventative measures on a personal front, and on the hospital front, they should be, virus. Sort of protective hospitals, meaning they should ensure the availability of all the necessary medications and oxygen. They should maintain proper documentation of the cases, and they should actually report certain cases which are influenza like cases or severe acute respiratory infection cases. They should report. So the people are aware and they can actually take things from there. Again, I am reiterating that the virus is not as bad and transmissible as COVID-19. Most of the cases are mild and do not require hospitalization. It is a common respiratory virus, which is mainly affecting our young children and elderly. So, elderly have to be aware, especially with their comorbidities, like I said before, diabetes and blood pressure. And it usually causes symptoms such as cold. Most of us may have already had it and we are not aware because we probably haven't gone for the nasal swabs which detects the virus. So again and again we are repeating that it we have to be aware and we should not panic. See, again, there have been certain studies which have actually seen that vitamin D is very effective. Vitamin D is effective in getting our immunity right and preventing certain viral and bacterial illnesses. So, as you said rightly, in cold we do not get to see a lot of sunlight, especially when we are having summer season. We get a lot of sunlight, and as we're getting old, in cold weathers, you can actually have certain infections like people already have bronchitis, which is like a lung inflammation, and they are more prone to catching infections such as cold. And especially in the virus can come up into your body because your immunity may be slightly low during winter months.